if they do not want to take the shot, if they do not want to take the jab, then let them pay for it themselves. I've seen that argument posed in multiple places. There's one particular commenter on my TikTok comments that says it quite regularly on many of the videos where I speak about the hesitancy with the jab, etc. And I could understand the argument, but I think that some people who pose this argument don't quite fully think it through, and some of it has a punitive side to it. Punitive meaning punishing. That it seems like the idea for some of this is meant as a punishment for some people, and that's not really what you want policies doing. Policies and the authorities, the government, policies coming from them. You do not want paternal policies. You do not want policies that make it that the government acts as your parent. They punish you when you do something bad in that way, and they reward you for doing something good. That's not the purpose of a government. The purpose of a government is, if there's punishment to happen, that is to happen to people who break the law. People who, the laws that we determine are necessary for our society to have a stable functioning and to continue perpetuating in that stability. These laws, if people contravene these laws, that's who we would like to punish. But it's not about punishing people for what we think is the bad or rewarding the good. That's not exactly what you want. So the punitive side of it is a bit dangerous. But I could understand some of the punitive side of it, especially when you see how some of this pandemic and some of the politics regarding the pandemic, well, some of the science regarding the pandemic has been politicized. And that may be some of the worst things to happen during this pandemic. I continuously have the feeling like what we may suffer from the most during and after this pandemic ends even might not even be the actual virus itself and the illness caused by the virus and the disease being spread. I feel some of the most suffering may be caused by the human reactions to these things as they happen. Possibly the most unfortunate part of the politicization in the pandemic for me is that the politicization is on a global scale. So if it was politicized in the small insular countries only, I think it may have been easier to be dealt with. If all the politicization of this virus had to do with PNM and UNC in Trinidad, or whichever are the two main parties in your island or in whichever country you are looking at this from, if it was only that level of politicization, I think that may have been a little more solvable, because it would have been problems that we would have been more accustomed to as a country. But now we have the case where the politicization is on a global scale. Over in the US, one of their senators recently came out and said boldly that he recommends to his constituents, to all listening to him, that they do not follow the new recommendations coming out from their CDC and their government in the pandemic and pertaining to the mask mandates and the lockdown measures, etc. And he is a doctor. The senator that said this is a medical doctor. So what do you do with that kind of information? A medical doctor saying that some of what the CDC is saying isn't sound science, it isn't proper medicine. And he is recommending to some people, do not listen to it. So to say that you have to listen to the science becomes a little more questionable there. Which science exactly do you listen to? But especially with that politicization, as I said, I understand the punitive nature, because if it's someone opposing you in politics, it doesn't just seem like someone who isn't making a right medical decision. It's someone who is making a wrong political decision. And generally, I think we would be willing to punish someone making a wrong political decision way more than we would be able to punish someone we think may not be making the right medical decision. And the irony of some of that is some of the people calling for some of these punitive measures, and the punitive measures are part of the politicization of this entire pandemic. And some of the people calling for these punitive measures are wondering why this issue is becoming so politicized. That is why it's becoming politicized, because we do not treat other medical conditions the same way. Let's go through some articles talking about this and see if we could see that and see the accuracy in that statement. I think we do not treat other medical situations the same way, and this difference we're treating the COVID pandemic with and the issues of who is hesitant about the jab, I think that difference has a bit of political edge to it, and that isn't working to help anyone. Alright, so an opinion written in MarketWatch. Do not, if you don't want the COVID-19 vaccine, then pay the full cost if you land in the hospital. Now, some of this you'd have to understand is written in, well, this article would be written in the American context. The Americans pay for their healthcare for the most part. The healthcare is basically privatized, where you'd have to pay for insurance, and if you end up in the hospital, then your insurance would cover it. But there's also a social safety net in the US. When you hear people talking about free healthcare in the US, you have to understand that they aren't talking just about emergency care, because if you go to a hospital and you are uninsured and you are very sick, they would still take care of you. There's Medicaid, there's Medicare, there are several different things to function in the case where there mightn't be any resources to fill that in. Also, to add to that, one of the first parts that many people chime in with this as a counter to it is that it breaks the Hippocratic Oath, that if someone is sick, a doctor or a hospital cannot turn them away. Now, the little I read about the Hippocratic Oath lately is, firstly, many doctors do not actually take the Hippocratic Oath. They do not actually say it. And many doctors who do say it do not say the original version, or they say several versions that have been edited and changed over time. So it's not exactly like do no harm and the ever familiar ones that you may be thinking. So the Hippocratic Oath might not actually have anything to do with anything in this case. If some doctor decides to refuse treatment, there may not be anything that can be done about that. Don't want the COVID-19 vaccine, then pay the full cost if you land in the hospital. Put your money where your mouth is, or get vaccinated. This article coming out from MarketWatch. It's an opinion piece, but it's being shared pretty widely, and it's an opinion being shared by multiple people. Over on Twitter, I see that a tweet sharing this same opinion and sharing the article to this has received several tens of thousands of likes, and several people seem to be going along with this idea. So let's check it. Much of the argument about lockdowns and mask mandates boils down to two disagreements about the level of risk that's appropriate to impose on others and how much should be left to individuals to decide. But now that vaccines are easy to obtain and have always been free to the recipients, the calculations have shifted. Those who choose to remain unvaccinated no longer pose a serious threat to the vaccinated, but they're still imposing a cost. Okay, so that's something I spoke about yesterday, and they're speaking about that. Here, the risk posed by the unvaccinated to the vaccinated actually isn't that high. So if anyone is saying that, you can correct them. That is not actually true. There is some risk, so don't say there's no risk. There is some, but it isn't that high. It isn't some real emergency level. Hospitalizations for COVID are almost entirely confined to those who are not vaccinated, often at the cost of tens or hundreds of thousands of dollars. That's true also. Most of the hospitalizations right now, even in Trinidad, are among the unvaccinated population. That's a fact. Do what you will with that fact if you disagree, but it's a fact. And something we always need to bear in mind, especially when getting healthcare done in places as beautiful and wonderful as Trinidad and Tobago, where our healthcare is free to us, at least free at the moment of getting it. It isn't free in the long run, but it's free at the moment you need it. So that freeness isn't actually free. If you were to get a bill for what that costs the entire country, it would be pretty astronomical. So keep that in mind. Not that I'm saying that that is a reason to force anyone to get the jab, but it is a fact. When you go to the hospital and you spend time there, the sum of money it costs the country is not zero. Who should bear those costs? Under our system of risk sharing, it's all of us, whether through government programs like Medicare and Medicaid or through private insurers. When someone who refuses to get the vaccine gets seriously ill, their bills currently are paid by taxpayers or others in their insurance group. Now, That in the American case would be true, but in our case that is even more true. So when somebody gets sick in Trinidad, the cost is even more shared among the entirety of the population. That's a positive in terms of helping people and helping our fellow man, our fellow citizen, but it's a negative in terms of if we're worrying about losing resources over people who aren't taking that good care of themselves. But why should the vaccinated bear those financial costs? Insurers led by government programs should declare that medically able, eligible people who choose not to be vaccinated are responsible for the full financial cost of COVID-related hospitalizations effective in 6 weeks. That gives time for the unvaccinated to make a choice based on their personal preferences and a truer sense of responsibility. Those who continue to believe that COVID is no more than a cold, or that the pandemic is a sophisticated fraud, or that sheep parasite medicine is more effective than vaccines with shockingly good efficacy, can put their money where their mouths and keyboards are. Now, I understand the sentiment, and that last paragraph, sometimes I could feel tempted to say it to people too. If you think that this is the better choice, then make sure all your responsibilities would fall all on you if you make the wrong choice in this case. But the problem with these things, the problem with these suggestions is the principle behind it. Because if we do this, to do it for this one thing, to do it for COVID only, for only the jabs pertaining to COVID-19, that would be unfair. That would be discriminatory. If you'd like to make a policy, you have to get the rule of that policy and make sure that that rule, the rule that you abstract out of the policy, could be sensibly implemented across the board. So let's see what exactly the rule of a policy like this would be. The abstract rule, as in the idea behind this policy, the idea behind this suggestion, is something like, if someone decides of their own choice, having been told otherwise, that they are going to engage in medically risky actions, then they should bear the brunt of the cost for it. That sounds about it, right? That someone who is irresponsible in choosing what they do with themselves, should a medical cost arise, they should be the ones to pay for it. I understand that argument, but I think many of the people making that argument don't understand that that is the American right-wing argument for why they think all hospitals should be privatized. Their argument is that's the case across the board for medicine. The argument is that they don't just want this for the pandemic. Some people who are making this suggestion mightn't understand that you might be actually playing into the hands of some of the people you think you oppose. This is privatizing of the healthcare system. Whatever you come down with, you pay because it's your responsibility. Now, even in the case of COVID, okay, you could say that someone is putting themselves at risk by not taking the vaccine. But there are many other causes that may put you at risk with COVID, and many of them are self-inflicted. Way back since last year, it was already known. A bit of confusion came out when it was announced that the CDC says 94% of COVID deaths in the US had underlying conditions. The now ever famous comorbidities, a term that we have become very familiar with now. Comorbidities. And 94% of the deaths had comorbidities. So then you could call this the pandemic, just as some are calling it the pandemic of the unvaccinated. There is a possibly cruel side, but you can seriously call it a pandemic of the comorbid. 94% is a very high proportion. So COVID is a pandemic of the comorbid. Non-communicable diseases that people have that increase their risk of serious illness and even death during this pandemic. So 94% are those. Out of those 94% of deaths that had other factors in it, how many of those other factors were self-inflicted? there was a study released coming out from the WHO. This is information that has been widely known already. But a short study showing a compilation of other studies with the risk factors associated with different non-communicable diseases. At the very top of this list is obesity. Obesity increases the risk for becoming severely ill from COVID-19. In a study in France, the odds of developing severe COVID-19 were 7 times higher in patients with obesity. Promoting healthy diets to maintain nutritional well-being is more important than ever in the fight against COVID-19. 7 times. That is a lot. 7 times higher in patients with obesity. And I haven't had a chance to look at this study. Maybe I'd see if I could get around to actually reading through this study. But I would wager that it's very likely that as the level of obesity rises, the level of risk from the virus rises also. So, a lot of obesity has to do with choice. Many people disagree with that idea. There are many people that like to talk about the medical factors to do with it, and there are medical factors and there are socio-economic factors, but the majority of it, if we are being honest, is choice. I remember I saw a small bit, I can't even remember the television show, but one of those reality shows going back a bit. And it was about an overweight woman who was making the excuse that she doesn't eat that much. She eats like a normal person. It's not about that. It's about her metabolism, etc., etc. So they planted cameras around her entire home and looked at her for a day. Let's leave it at being, it's safe to say that she didn't eat like someone who wants to remain at a slim size. Most of the cases of obesity has simply to do with intaking more calories than you expend. It's a choice. So if you're saying that any personal choice that puts me more at risk of ending up in the hospital I should pay for, then someone who let's even it out, because the person suggested that it's not everyone who doesn't take the vaccine, someone who doesn't have a medical reason. So anyone who doesn't have a medical reason for being obese, should they pay for their hospital bills as well? And should it only end at COVID-19? Because obesity increases your risk of many other illnesses. So if you are an overweight person and you go to the hospital for any illness that is exacerbated by your weight, should you pay for that? And next in the list of the NCD, non-communicable disease risk factors from the WHO, is smoking. In a meta-analysis, smokers were 1.5 times more likely to have severe complications from COVID-19 and a higher mortality rate. So, any smoker going to a hospital to be treated for COVID-19, you have to pay too, because smoking is a choice, and you are making this choice that is putting you at greater risk of costing all of the taxpayers more money. Next on the list, alcohol. Alcohol impairs the body's ability to fight infections such as COVID-19. Even a single heavy drinking session can measurably reduce immune function. Intoxication can also interfere with taking precautions against infection. So anyone found to have been inebriated or to have drunk any time during the time where they would have been infected by this COVID and then they end up in the hospital, they must pay. Next on the list is physical inactivity. Physical activity provides multiple short and long-term health benefits, including improving the immune system, stress and anxiety. Physical activity is also associated with prevention of heart disease, hypertension, diabetes, and overweight and obesity, which are risk factors for severe COVID-19 disease. So anyone who's physically inactive and they get COVID, then you must pay also. You're seeing where this is getting eventually. If you continue going down that line, the line is going to move to the point where let everyone just pay for their healthcare and done. And if that's your view, I'm not sure I'm against that, just by the way. I'm not sure that I'll be totally against everyone paying for their own healthcare, because I could understand the argument. But my problem with that is who catches the people that are missed. in Trinidad right now, there are lots of people who, if we were to make all healthcare private and everyone must pay for their individual healthcare, there are many people who would die because of that, because they wouldn't be able to pay for it. And in some of those cases, some of the illnesses, some of the diseases, some of the things that they may be struggling with may be partly their fault. But the idea behind society helping, the idea behind the social safety nets, the idea behind all of these measures is that we help people in spite of. And we have already established the rules in our society by which we throw people out of this help for. If you break these rules, then society wouldn't help you in this way. And then the case is, even if you break some rules and you end up in prison, society would still help you when it comes to healthcare. So I'm not sure that pay for yourself is an actual solution. What do you think? If you haven't clicked that like button yet, don't forget to click that like button and drop that comment. Tell me exactly what do you think. Do you think that it is feasible to try to make everyone who hasn't taken the jab pay for their own healthcare because of it? Or do you think that that is opening the door for entirely privatizing the entirety of healthcare? And if you'd like that, well, then you may be a very free market right-wing person. Or if you don't like that, and you're further on the left side and want a stronger safety net, social safety net, then that may not be such a good idea. Hope you were entertained by this, or at least enjoyed, or at least were informed by this video, and I'll see you tomorrow.
And you feel the music, rising with the time.